Actually, let's take one step up. So we're going to talk about purpose and task. So broadly speaking, I guess the system objective for the types of clinical decision support that we're building is to mimic, I guess, the job of a physician. So it doesn't necessarily mean that we're going to replace physicians or what have you. Obviously, this is like very low level stuff, but sort of like the objective function of these pipelines is to do the types of tasks that physicians can do. So those tasks fall kind of neatly into some combinatoric of three different purposes. So broadly speaking, physicians do some combination of only three things: diagnosis, prognosis for a certain outcome, and treatment. So we call that in the iChai lab the DX, PX, TX model. So if you think about traditional physician tasks, like for example triage, that's a combination of DX and PX. So if you think about, well, that could be within a patient or between patients, you basically have to determine the diagnosis, determine the prognosis, which essentially gives you a risk stratification for who is likely to die without intervention or have some serious injury, and then that naturally stratifies to some type of triage order. So it could be triage of diseases within the same patient. So do we go after diabetes first or PAD first? Or it could be as between patients. So is this patient sicker than that patient based on whatever your input vector is? Make sense? So those tasks then can be broken down into what we're going to talk about in the next video, which is the multimodal framework.